Right before the break, I had teased the fact that Congressman Chip Roy was going to be with us to talk about the Judiciary Committee discussion about abortion today. But House schedules have changed and Congressman Roy must tend to them. So we are going to have a slightly different conversation, but just as important conversation. Many of you are frustrated in the height of the COVID lockdowns by the power that local and state, and in some cases federal governments tries to seize in the context of a medical health emergency. Well, recently it seems that the World Health Organization is trying to take steps so that they have power here in the United States in the event that there is another health event, another pandemic. And here to tell us about what's going on with WHO is Travis Weber, VP here at FRC. Travis, good to see you.
Thank you.
So tell us what's going on at WHO.
Yeah, so the World Health Organization is going to meet in Geneva, Switzerland next week to begin debate on proposed changes to the international health regulations. Now, this might sound a little obscure. You know, many people might not know exactly what the WHO does or the regulations, but these are the focus of efforts, focus of a lot of attention after the COVID pandemic as we kind of move past a 2-year point after a lot of the energy of the COVID pandemic began over 2 years ago. But you know, as we're at this point, the Biden administration is proposing changes to the international health regulations to presumably deal with other pandemics better in the future. So it's understandable why they want to propose these changes, but the consequences are what we need to look at. Permanently locking in changes that would alter the balance of power right now between the WHO and member states in favor of the WHO.
Right.
And that means in favor of unelected bureaucrats, in favor of many, many people behind the scenes making decisions, and the private money, the Bill Gates money that funds the WHO, influencing all that without any accountability, without any political accountability from the people that the people are able to exercise, who the WHO is presumably serving. So this is understandably a problem. And at least the Biden administration needs to offer the American people an explanation of what it's doing, aside from the wisdom, the lack of wisdom of giving more power to a world body like this, because it's not the past pandemic that we're going to be you know, kind of laser-like focused on in the future. It's going to be a future one or future consequences to the changes now we're looking at permanently locking in. So this is a major problem.
And Travis, I think a lot of us feel like we'd like to see some changes in anticipation of another pandemic, but most of us feel like we'd like it to go the other direction. We'd like there to be more accountability on emergency powers, so emergency powers can't be wielded for as long a period of time without the input of elected officials. This seems to be moving in the other direction, though. Do you have any sense of what changes would be made? So what kind of power the World Health Organization would have over us here in America?
Yeah, so these are the Biden administration's offered proposed changes to the international health regulations. They deal with a number of articles of these regulations involving the response time by which a nation state is expected to respond. You know, so it's sort of the window that a state is expected to respond to the WHO in the case of a pandemic and provide information and respond with its plan for tackling the pandemic. And the consequences, you know, that follow are part of this discussion as well. Now, you know, these regulations don't have, you know, hard consequences in terms of being enforceable like law from our analysis, but it does. This is going to create, you know, if you have a regulation like this and then nations are, you know, there's a claim that they're not responding to, they're not complying with it. Imagine the international pressure that creates from other nations, from the public, from the media. And we saw this during the COVID pandemic. So we should not be creating a situation like this where we're aggregating power in the hands of the WHO. So response time, response plans, the nature of the information provided by a state to the WHO, these are some of the areas in which the Biden administration is proposing changes that would lock in a more detailed prescription in favor of the WHO. So a major problem here. Now, these changes are also being probably going to be looked at as part of a pandemic treaty process, which is separate from what I'm just discussing, separate from that, but similar policy prescriptions likely to be raised.
Travis?
Major issue.
Let me ask you a question on that point. How does the United States become committed to something like this? Does Congress have to act? Is this something the White House can do unilaterally?
Yeah, so on the regulations, it's run by the White House, and the executive branch has power for foreign affairs. Now, there's an obligation. We should be consulting with Congress, but there's no hard constitutional requirement in the same way that a treaty has to be given advice and consent by the Senate before we become a state party to the treaty as a matter of international law. So, different from the treaty. These regulations, though, the Biden administration is engaging with the World Health Organization directly. Congress needs to say something, at least raise a concern, raise a question. The American people deserve answers because we're looking at aggregating power here, and that alone is a problem.
Right. Travis, it is concerning. I think a lot of us are very uncomfortable with the idea that we would now have the World Health Organization determining the response, the kind of lockdowns that could be required in the future. It doesn't seem to be a path to a better reaction and a better experience should something like this happen again. But thank you for coming on and letting us know about it today.
Thank you.